छात्रों में आत्महत्या की समस्या को रोकने के लिए सबसे बड़ी आवश्यकता है कि हम इसे पहचान सकें। हर एक छात्र में जब वो तनाव से गुजरता है तो उसमें कुछ न कुछ मानसिक परिवर्तन होते रहते हैं, और ये मानसिक परिवर्तन उसके व्यवहार में, उसकी मानसिक शक्तियों की कमी में, उसके हाव भाव में पहचानी जा सकती है। अधिकतर लोग जब इस तनाव से गुजर रहे होते हैं और उनके मन में ऐसे विचार आ रहे होते हैं कि मुझे जीना नहीं है, या जीना अच्छी बात नहीं है, जीने से फायदा नहीं है, जब वो निराशा की भावनाओं से गुजर रहे होते हैं तो उनके व्यवहार में भी उसी तरह के परिवर्तन आता है। और इसलिए यदि हम ये जानें कि ऐसे कौन से परिवर्तन हैं जो व्यवहार में दिखाई पड़ते हैं, तो शायद इन बच्चों को, इन लोगों को पहचानना आसान हो जाए। जैसा कि शोधकर्ताओं ने, विद्वानों ने लिखा है, पाया है कि ये परिवर्तन में पहला बिंदु है निराशा की भावना। निराशा की भावना का आत्महत्या से सीधा संबंध है। जब निराशा की भावना बनी रह जाती है, उस पर बातचीत नहीं होती, तो वो आगे चलकर डिप्रेशन का रूप लेते हैं। ऐसे बच्चे, ऐसे लोगों से मिलना जुलना कम कर देते हैं। सोशलाइजेशन, सोशल एक्सप्रेशन, सोशल रिलेशनशिप में कमी आती है। एंगर, एंजाइटी, गुस्सा, एजिटेशन, अब ये सब बहुत ही सामान्य भावनाएं हैं, बहुत ही सामान्य व्यवहार है। लोगों को ये बताना कि जो लोग गुस्सा करते हैं वे आत्महत्या कर सकते हैं क्या, इस प्रश्न का उत्तर बहुत कठिन है। परंतु किसी भी व्यक्ति में जब अचानक कोई परिवर्तन आता है तो उस पर ज़्यादा ध्यान देने की आवश्यकता है। उसका कोई ना कोई विशेष कारण होता है। अधिकतर हम ये कहेंगे कि जो लोग या जिन लोगों में आत्महत्या की संभावनाएं ज़्यादा हैं, या जिनमें आत्महत्या का जोखिम ज़्यादा है, जब उनके जीवन में घटनाएं घटती हैं, विशेषकर नकारात्मक घटनाएं घटती हैं, तो उनकी मानसिक दशा अधिक दुखदायी हो जाती है। और सैडनेस, होपलेसनेस, हेल्पलेसनेस, विश टू डाई, विश टू किल हिमसेल्फ तरह की भावनाएं उत्पन्न होने लगती हैं। विचार करने की पद्धति चेंज बदल जाती है। नकारात्मकता उनके जीवन का केंद्र बिंदु हो जाता है। बहुत से लोगों में याददाश्त की समस्या से ये शुरुआत होती है, भूलना शुरू करते हैं। कुल मिलाकर मानसिक स्वास्थ्य का पूरा आकलन होना चाहिए, तब हम जाकर ये पा सकेंगे कि क्या किसी में मानसिक स्वास्थ्य में गुणात्मक परिवर्तन हो रहा है, वो ठीक हो रहा है या बिगड़ रहा है, और किस समय उसे क्या मदद दी जानी चाहिए। तो इन समस्याओं को पहचानने के लिए एक पैनी नज़र की आवश्यकता है। अगर बच्चे स्कूल में हैं, कॉलेज में हैं, तो मैं ये नहीं कहता कि लोगों को आत्महत्या के डर के साए में जीना चाहिए, लेकिन आत्महत्या या मानसिक बीमारी या मानसिक तनाव नहीं हो सकता, इससे मुतमईन भी नहीं होना चाहिए। Complacency is not good. People are vulnerable, and we have to remember that people are sensitive. There are pressures around. They all go through pressure of academia, pressure of friendship, pressure of peer group. They are exposed to a rash life, very speedy life, under pressure of performance, quality to bringing qualitative change, making more money, becoming more successful. There are a lot of things which are going on in their mind, which is very complex, socially, psychologically, and spiritually. I'm not talking about impossibilities, I'm talking about possibilities in the manner that the steps which we take or we teach people to take, we ask people to practice discussion, dialogue, openness, frankness, winning over stigma, not trying to shy away from problems, from facing the problems, and trying to trust people and confide in those friends and relatives whom they feel that they are going to be hurt, they are going to be listened to. ये छोटी छोटी बातें हैं जीवन में जो परिवर्तन लाती हैं। आत्महत्या की समस्या हो या डिप्रेशन की समस्या हो, समाज के स्तर पर इसका इलाज एक अलग समस्या है, व्यक्तिगत तौर पर इसका इलाज एक अलग समस्या है। दोनों मिली हुई चीज़ें हैं, मगर फिर भी अलग अलग तरीके से देखी जानी चाहिए। विशेषकर जब हम परिवार से बातें शुरू करते हैं तो मुझे मालूम है कि बहुत से लोग पूरे परिवार मिलकर योगा करते हैं, ध्यान करते हैं, मेडिटेशन करते हैं, बहुत से लोग स्किल ट्रेनिंग करते हैं। पहले लोग साथ बैठकर पढ़ते थे, इट वॉज ए ग्रुप लर्निंग प्रैक्टिस, जिसकी अच्छाइयाँ एक अलग किस्म की है। पढ़ाई लोगों को जोड़ती थी, दोस्तों को जोड़ती थी। वे जानते थे कि कौन दाएं हाथ से लिखता है, कौन बाएं से लिखता है, कौन लिखने में गलतियां करता है और कौन बुद्धिमान इंटेलिजेंट होते हुए भी फेल होगा क्योंकि उसे यह लिखना नहीं आता। ये दोस्तों को मालूम था। मगर हम इसे स्पेशल लर्निंग डिसेबिलिटी कहें या ऑटिज्म कहें या वैज्ञानिक तथ्यों के नाम पर कोई भी नाम दे, नाम में कुछ नहीं है। नाम में सिर्फ ये है कि एक वर्ग मानसिक समस्याओं के लिए अधिक जोखिम में है और एक वर्ग नहीं है। जो है उनकी पहचान जरूरी है। और कौन उन्हें इससे अच्छा पहचान सकता है जितना उनकी माताएं उन्हें जानती हैं। माता पिता जिन्होंने बच्चों को बड़े होते देखा है, उन्हें उनकी एक एक आदत, एक एक अच्छाइयाँ, एक एक बुराइयाँ, सब पर उनकी नज़र रहती है, उनके ध्यान में रहता है। लेकिन उनका महत्व क्या है? लोगों को ये नहीं मालूम कि वे कौन से कारक हैं जो लो रिस्क को हाई रिस्क में परिवर्तित करते हैं। जो जहाँ समस्या जो बालक झेल सकता था, उसे पकड़ सकता था, वो पकड़ उसके हाथ से छूट जाएगी। इसका ज्ञान माता पिता अध्यापकों में इतना अधिक नहीं होता है जितना होना चाहिए। और इस बात की आवश्यकता है कि हम ये जानें कि लो रिस्क फॉर सुसाइड कन्वर्टेड टू हाई रिस्क ऑफ सुसाइड, ये जो अंतर है, ये जो ब्रिज है जिस पे आदमी अकेला चलता है तो वो वल्नरेबल होता है और जाकर आत्महत्या का प्रयास करता है। यही एक विंडो है जिसमें लोगों को बचाया जा सकता है। और इसी विंडो, इसी अपॉर्चुनिटी की तलाश हर उस संस्था को, आदमी को रहती है जो इस विषय में काम करना चाहता है। चलो देखो कितना मिनट हो। डिप्रेशन इन स्टूडेंट्स। Depression in college campus in children is one of the important area of health that we need to talk about. Depression is directly related to problem of suicide, particularly among students, and therefore it is important that we pay attention to problem like what we call depression. Depression is an emotion and it's a problem of emotion that everybody knows, but there are three important issues that we need to discuss and we know about. The first, how do we identify depression? The second, how do you treat people with depression or students with depression? And the third, how do you receive them back in the system of academia? लोगों में, छात्रों में डिप्रेशन की समस्या को पहचाना कैसे जाए, उसका इलाज कैसे किया जाए, और जब वो ठीक हो जाए तो उन्हें वापस मुख्य धारा में कैसे लाया जाए। सबसे बड़ी समस्या स्टिग्मा की है। लोग छुपाते हैं, बोलते नहीं हैं, उंगलियां उठाते हैं क्योंकि उन्हें अभी भी उनकी कुछ लोग ऐसी धारणा है कि डिप्रेशन बीमारी पागलपन जैसी। पहली बात तो पागलपन जैसा कोई शब्द है नहीं जिसकी परिभाषा वैज्ञानिक तथ्यों से बताई जा सके। डिप्रेशन उसी तरह एक बीमारी है जैसे हाई ब्लड प्रेशर है, जैसे डायबिटीज है, आर्थराइटिस है, ये कोई और बीमारी। ये ब्रेन सेल्स उनकी केमिस्ट्री में, उसकी केमिकल सब्सटेंसेस में परिवर्तन से संबंधित है। जिस समाज में वो रह रहे हैं उस समाज के कारणों से संबंधित है और उनके अपने मानसिक तनाव से संबंधित। फिर ये सवाल कहाँ उठता है कि इसमें कलंक या सामाजिक कलंक या सोशल स्टिग्मा, ये प्रश्न क्यों आता है? इस पर विचार करना और इसकी रोकथाम करना, to be proactively becoming a champion to promote the cause of treatment of depression is one of the prime requirement of each and every person. So early identification of depressive disease. One may pass through a phase where you feel hopeless or helpless and do not develop all the symptoms of depression. But even this phase where you feel hopeless is equally disabling, challenging for you. You don't feel like getting up, you don't feel like going to your office, or don't feel like opening your books. You feel loss of energy, lost your appetite, you cannot eat, and people calling you, you don't want to respond, you don't want to connect on your telephone, you don't want to reply on social media. You isolate yourself, make a shell of your own and sink into it. You develop a dark halo around your own personality. You don't allow others to reach to you. Your psyche is becoming totally introverted, introjected. Your all energies are become negativistic and invested in yourself. And the consequence is that it affects your memory, it affects your mood, it affects your ability to work, performance, relationships, sexuality, your activities, and of course the disastrous consequence of suicidal ideas, which may convert into suicide attempt, is very much a potential danger. So these are some of the symptoms which can help you identify early changes in your mood. Mood is not a borderline, it's a range which fluctuates, modulates, goes up and down in normal fashion. It is regulated by the environment as well as the structures within your brain. So the harmony between the body, mind and the environment is disturbed, and therefore you develop symptoms. Some of the conditions are self-limiting, that people do become depressed for a short while due to any stressful factor, and they become quite alright, there is no problem, they carry on with their life. But some people have a high genetic loading, they have been having depression in the families, and if they develop early symptoms, then that's a serious matter. It must be recognized. Family history of depression is extremely important factor for care of a person who is suffering from depression. Once you have been able to identify early signs of depression, you can yourself arrange for its management, its treatment, and move on. Otherwise, a situation comes when others point out, because your behavior changes, things go out of your control, you lose weight, your behavior changes, become angry, you develop anger, hostility, paranoia, suspiciousness, hearing voices, and many other serious psychiatric symptoms, which you lose capacity to realize and understand what you are doing, where you are, what are your functions, what are your duties and responsibilities. You start making mistakes which others point out. So if you do not recognize the early signs, then a stage comes when others point out symptoms in you. So this is an early identification. In this manner we can, if we know the information, we can catch these symptoms young. And how do we arrange for interventions? What do we do? It's a balance of doing things to correct your mood and arranging things which hurt you from social situations. For example, many of people go through a situation of stressful period in their job, in their marriage, in their postings, in transfers, in migration, changing countries, etc. But that's the fact of life, that's the reality, and the coping ability is poor, so you have not been able to cope and you develop the symptoms. Once you develop the symptom, the answer is treatment. And the medical treatment, the psychiatric treatment, be it with counseling, psychotherapy, pharmacological agents like antidepressant drugs, or in serious cases TMS, ACT, and many other kind of treatments, hospitalization for providing safety, they all are effective. But the main issue comes, how do you take care about yourself? How seriously you have realized your problem? How much you comply with the medication doses? How much have you understood to make changes in your lifestyle? These things are important because medications will help you to a certain extent. They help you to an extent so that you can build psychological resources over and above it and be the same person that you were. But without medication, in some cases where it is necessary, even if you try and everybody in your family tries to help you, it may not be possible to come out of depression. So you have identified depression, you have arranged for the treatment. Now the question is, what after that, when you are returning back to your school or your college or your university, and the main challenge lies here. Most of the people hide, one can understand, but they also stop medication They also stopped the routine that they were advised and they were following. And they walked through the same difficult zone. They land up in the same difficult area of their university curriculum, studies, books, problems that was pre-existing before you started having symptoms of depression. Now it's like एक जलते हुए घर से बाहर निकले और लौट के आए, फिर उसी घर चलते हुए घर में बैठे. That approach is not acceptable. Change has to be there. It has to be restructured. Your work, your income, your responsibilities, your duties, your initiative, everything needs restructuring so that you get the breathing time and allow your psychological energy, psychological resources to re-emerge and build you. जो घर जल गया उसे फिर से बनाना. Let's look at it in this perspective. But actually what happens, many students relapse. They do not relapse because they are the candidate to become chronically depressed person. But they relapse because we do not take care about the rehabilitation or realignment of their lifestyle. We do not remove the stressful factors from their life. People become depressed, go for treatment, come back and live in the same difficult marriage without sorting out their conflicts. People become depressed, they resign, the resignation is taken out, boss is convinced, he takes it back, and the person walks back into the same problem zone without making any change in the source from where the problem has arisen. Not only this, many people do not make change in their own personal lifestyle to increase their mental strength to fight the next bout of depression. Once we have an episode of depression, we remain at risk for developing another episode for lifelong. It's a relapsing difficulty, relapsing disease, and one must be very careful about it. So these are some of my thoughts that students, college mental health, examination, stressful factor, depression, coming back to school, facing the challenges, you need to prepare and take help of your teachers, parents, friends, how to prepare to get back to the same seat and come to the driver's seat where you were sitting before. And I'm sure treating depression is pretty simple. It's not that difficult disease that one imagines. Most of the people suffering from depression they are completely treated and they make changes in their life and they become highly functional, highly successful. A line about success in depression is mental health issues can be a gross barrier in becoming successful. However, if you have become successful, you also remain vulnerable to develop mental health issues. About half of the people who achieve their goal develop psychological diseases in next few years. So we should not forget that mental health issues are realities of life. We need more information, take proactive action, arrange for treatment, bring reform in ourselves, and fearlessly face the world and try to bring change and live the lifestyle that suits you. The lifestyle which saves your brain cells from dying. Every second of a chronic stress is injurious to brain cells. you must remember and never forget that ultimately the liability of load of depression will show in your productivity and happiness and richness of your emotion at some point of time. And therefore, it's a movement. College mental health is like a movement, mass movement. Students must mobilize first to ensure that they get the facilities and resources to treat depression in their own classrooms, in the colleges, in the universities, rather than waiting for someone else. There is no someone else. Waiting will be too late and the price will be too hard. Suicide and mental health issues are interlinked. It is almost impossible to delineate one from the other. And I'm particularly talking about depression amongst the student population, youth of India. All over the world, people in the age range of 14 to 24 are at a very high risk for suicide behavior. In suicide behavior, they may show a gesture, they may talk about it, they may make an attempt which is only a milder attempt which will not take their life. They may make a serious attempt, and for almost 30, 40, 45% of people, the first attempt is the last attempt. They succeed. Many times the person who is trying to attempt suicide makes error of judgment. He is trying to convey his feeling, he is trying to talk and communicate his distress, but the mode and method which he adopts, using tablets or overdose of opiate or any drugs or substances, may go wrong. And though they did not want to kill themselves, they attempt and they finally die. And therefore suicide behavior is a complex behavioral problem. There are a number of shades in this scenario. There are people who make a repeated attempt. A person who has attempted suicide once is number of times is the first high risk person to attempt suicide again. And therefore attempted suicide gives us an opportunity to work with them and at least prevent their another attempt. That's the approach which public health is adopting. What do we do? All of us, we receive patients who have attempted suicide in the hospital. They are transferred to psychiatric departments, we treat them. So what do? We try to handle that repeated suicide attempt is not taken. But what about the first attempt? Most often the phenomena of suicide, it is seen that it happens in a transition phase. When a person is transiting from a healthy state to a state which is hurtful, highly stressful. In this transition, whatever biological, psychological and social changes take place, that increases their vulnerability to kill themselves. Transition is a high risk situation. So when we talk about risk, we can consider talking about people at risk, situation at risk, and factors which are risk factors. That means people, those who are having a mental disorder are high risk for suicide. Among situation, those who are passing through a difficult life situation, for example, somebody has lost his job, somebody has undergone a divorce in personal life, or relationship issues. This is a change. A change and a transition precipitates, it dissipates your mental strength. You need a lot of skills and problem solving art to sort out the issue of your emotions, to maintain your balance, to allow your brain and mind to function in a harmonious manner the way it should. These are the psychological skills which save life. Similarly, it could be factors like alcoholism and drug abuse. Or let's say economic transition. Suicide increases whenever there is economic recession. People, when they pass through an economic downfall, they drift towards behavioral change. They automatically get into the catch of a lifestyle which is injurious to health. They get into alcohol, they get into smoking, loneliness, suffering, decreased socialization, inability to express their emotions, finding nobody to talk to, finding themselves lonely in a crowd. They don't know how to handle their confusion. In fact, whatever they know, they tend to forget it because the brain functions in a manner and a style where emotion, the cognitive control, the intelligence control over emotion are there harmoniously working together, gets disrupted due to acute or chronic stress. What do we do then? Best possible answer is to adopt a lifestyle which is healthy. What is healthy lifestyle? A healthy lifestyle is one in which you function normally with whatever skills you have, allow that to be expressed and used, rather than doing something which kills your own strength and skills. For example, you may be a very good person to negotiate a deal. You may be a very good person to do arbitration. But if you forget the art which you use, you forget your problem solving skills that you yourself use and do not apply that in your own mind and your own interest, when you pass through, when you are passing through a crisis, then the situation becomes dangerous. And psychiatric disorders are exactly notorious in this sense. They first block the capacities that we have. They minimize, reduce, diminish our energy. They induce psychological retardation. You feel you don't want to get up and go and talk to somebody, to your neighbor. Normally you go and meet your friend, you forget to do that. That is how slowly depression, hopelessness, helplessness creeps in. That's the beginning, vulnerability, the stage of at risk. And here it is important to recognize. And as I said, most of the suicide happen in vulnerable candidates during transition when they do not have a mental disorder. In fact, a significant number of research has proved that people who attempt suicide and go to the hospital and they are treated, more than 50% of them have been found to have no mental disorder. So let us not confuse ourselves with mental disorder and suicidality. Suicide is ideas of suicide are expressions of distress and the style of your own brain's function. And of course this tells us what is the nature of our brain development, how our genes get expressed, how brain forgets to transform the gene expression in interest of maintaining healthy life when the atmosphere and environment is not conducive. कितना मिनट